In this video, I'm going to tell you the medications you should avoid if you have glaucoma. But first, let me tell you a quick story about why this information is so important. It was a Friday night in New York City. I was working a shift in the eye emergency room and this guy came in. He was in his 40s. And he mentioned a few hours before coming in that his eyes were starting to become sore. He said that they felt tight and painful. Then his vision started to get blurry. Light started to develop a glare. Then he said his eyes became red and swollen. His vision got even more blurry. Lights made him extremely uncomfortable. And so he decided to come in and to get it checked out. I was a second-year resident at the time, and just with my first step into the exam room, I thought to myself, uh-oh. By the time he came in to see us, this was an outright emergency. This poor man had tears running down his cheeks. His eyes were red and swollen. He was half slumped in the exam chair and looked defeated. Trying to examine him was not easy. He was so sensitive to light. Even after giving him numbing eye drops, I had to basically try to pry his eyes open just so I could take a look at what was going on. That's when I realized the eye pressures in his eyes were 60, whereas the normal range should be 10 to 20. An eyeball, if you press it gently, should feel a little squishy like a grape. But when eye pressure is high, like in this poor man's, our eyeballs feel rock hard like a marble instead. And when the pressure is that high, it can be very painful. Not only is the pain bad, but if these high pressures are left untreated, it can leave a person blind after only a few days. So the stakes were high. What was going on? I treated a few patients before with acute glaucoma attacks before, but the strange thing about this case was that it was affecting both eyes at the same time in a guy who just a few hours ago was sitting at home watching Netflix with his dog. Okay, so let's take a step back for a second. So these glaucoma attacks that we eye doctors see are usually a case of what we call acute angle closure glaucoma. So what's acute angle closure glaucoma? Well, the eye is filled with a clear fluid called aqueous humor, which is produced by a structure called the ciliary body. This fluid flows out of the eye through a small drain called the trabecular meshwork. The trabecular meshwork is located in an area called the drainage angle. If this drainage system is blocked or isn't functioning well, then the fluid can't flow out of the eye properly, causing eye pressure to increase. That increased eye pressure can lead to damage to the optic nerve. If the pressure increases slightly, maybe to 25 or 30, then it might be months or years before significant damage to the optic nerve accumulates to affect our vision. But for various reasons, that angle can sometimes become completely closed. When that happens, then there's no way for the fluid inside your eye to leave. So fluid keeps building up inside the eye, like if you're filling up a water balloon with no way to turn off the faucet. As that fluid builds up, the pressure can start to increase to 50, 60, or 70 millimeters of mercury. And when the pressure becomes that high, then it can become very painful. And the pressure inside the eye is so high that the blood vessels in the eye can get pinched down from the pressure. And so you can literally cut off blood circulation to the structures in your eye. And this is very dangerous because once you cut off blood circulation to your eye, then you cannot deliver oxygen to the structures in your eye. And that's when you can get permanent blinding damage to your eye and your vision over the course of hours. And so one key component of every eye examination we perform in our office is to see how your drainage angle looks. We can look with our microscope and we can use special lenses called a gonioscopy lens or perform a special scan called an anterior segment OCT to measure how open or closed your drainage angle is. If during your exam we see that you have a narrow angle, then we know that you have an increased risk of developing acute angle closure glaucoma. For example, the rate of acute angle closure in general is quite rare, about 1 in 1,000 depending on the study you read. But in patients with narrow angles, we know that they have a higher risk of developing angle closure and angle closure glaucoma. The exact rate will vary depending on the population you're studying, but generally, studies have found that patients with narrow angles have anywhere from a 10 to 35% risk of developing outright angle closure or angle closure glaucoma. And to me, that's now a meaningful amount of risk. And for patients who have had an acute angle closure glaucoma attack in one eye, researchers have found that these patients have a 51.3% risk, or basically a 1 in 2 chance of developing an acute glaucoma attack in their other eye. So for patients with narrow angles, we know that they have an increased risk compared to the general population of going on to develop angle closure and angle closure glaucoma, which is obviously a threat to their vision. This is why, if you have narrow angles, an eye doctor may recommend to do regular eye exams so they can check your eye pressure and check your drainage angle. Or they may even recommend doing a surgery like a laser procedure or cataract surgery to help open your angle to prevent angle closure glaucoma. But one thing we often miss as eye doctors is talking about how the medications you take for things like treating a cold, for weight loss, for headaches, or for your mood can have a very real impact on your risk of developing angle closure glaucoma. This is because many medications, some really common ones, have been shown to cause a narrowing of your drainage angle, increasing your risk of developing glaucoma. So let's go back to our Friday night in New York City. We have our patient sitting there in pain with eye pressures of 60 in both eyes, and he feels like his eyes are going to pop. When I took a look at his eyes, I saw immediately that his angles were completely closed. His irises were basically onto his corneas, his drainage angle was shut closed and there was no way for the fluid to escape from his eye. That patient was suffering from acute angle closure in both eyes at the same time. And I mean, yes, we eye doctors, we see acute angle closure. But to see it in both eyes at the same time without any history of trauma or other inciting factors, that's pretty rare. And I was puzzled, so I asked him more questions. Are you sure you didn't get hit in the eyes? You didn't do anything new recently? And that's when he said, oh yeah, well, I started a new weight loss medication last week. It's called Topamax. Ding, 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 light bulb. That was the answer. You see, Topamax is actually a pretty popular medication that's used to treat headaches and also for weight loss. But it's notorious for having an eye-related side effect that most doctors or pharmacists don't mention when they prescribe the medication: angle closure glaucoma. You see, Topamax can also have unintended side effects on your eyes. Medications like Topamax have been shown to sometimes cause the lens and iris inside our eyes to be pushed forward. When that happens, this forward movement of the lens and iris can cause the drainage angle to close. Once that angle is closed, the fluid inside your eye has no way of draining out, so your eye pressure can build up very quickly, like it did for this poor patient. Once I realized that it was the forward movement of the lens and iris from the Topamax that was causing his acute angle closure attack, I was able to give him the proper pressure-lowering eye drops as well as a muscle-relaxing eye drop called cyclopentolate to help push the lens back and open up his angle again. Within a couple of hours, his eye pressures dropped back down to the 20s, and of course, I told him to stop taking his Topamax. Luckily, he escaped his angle closure glaucoma attack without any long-term damage to his optic nerves or his vision. But if he waited longer and didn't get prompt medical care, his outcome could have been very different. And so, if you take Topamax or other medications that can increase your risk of developing angle closure glaucoma, which I'll get to in a second, don't wait until you develop bilateral angle closure glaucoma and it's a medical emergency. You can get your eyes checked sooner to see if they're causing you to have narrow angles, which increase your risk of developing a glaucoma attack. Or if you already know that you have narrow angles before studying any new medications, then now you have the risk of your anatomy, the narrow angles that you were born with, and your medication making it even more narrow. So that increases your risk even more. So if you have narrow angles, before starting a new medication, you may want to discuss with your doctor to determine whether that new medication will increase your risk of developing a glaucoma attack. Before we go through the most common medications which can cause angle closure glaucoma, I'd like to tell you about my optimized newsletter. I compile evidence-based ways to help maintain your vision and health and send that information directly to your email. You can visit my website at michaelchuamd.com and sign up for the newsletter today. Okay, back to some of the most common offenders of medications which can cause angle closure glaucoma. SSRIs. One of the most common medications we encounter with narrow angle glaucoma are psychiatric medications such as antidepressants, selective serotonin reuptake inhibitors or SSRIs, and some of the most common ones are citalopram or Celexa, fluoxetine or Prozac, or sertraline, which is also known as Zoloft. These medications work by affecting serotonin receptors in the brain, but you also have serotonin receptors in your eyes. And so taking these medications for your mood can also have unintended side effects to your eyes. They can cause you to have a narrow or outright closed drainage angle and increase your risk of developing angle closure glaucoma. SSRIs have also been strongly linked to an increased risk of developing dry eye syndrome. So that's another side effect that both your eye doctor and primary care doctor or psychiatrist want to be aware of. Over-the-counter cold medications and nasal decongestants often contain phenylephrine and pseudoephedrine. Some common examples of these medications include Sudafed, Mucinex, or any allergy medication with a D, which stands for decongestant. So like Allegra D, Claritin D, or Zyrtec D. Phenylephrine and pseudoephedrine can cause the pupil to dilate, which can incite a condition called pupillary block. Basically, what can happen is when your pupil dilates from the medication, the back surface of your iris can get caught or stuck on the lens inside your eye. When that happens, your iris and your pupils block the fluid in the back part of your eye from being able to flow to the front part of your eye where the drain is, hence the name pupillary block. If that fluid can't move towards the drain in the front of your eye, then the eye pressure can build up and you can have an acute glaucoma attack. Sulfa medications such as the popular antibiotic sulfamethoxazole or Bactrim, diuretics like acetazolamide or Diamox, or popular blood pressure medication hydrochlorothiazide, and of course Topamax have all been shown to cause acute angle closure glaucoma, like we found out on that Friday night in the eye emergency room. Lastly, a common class of inhalers used to treat asthma or COPD can also cause angle closure glaucoma. Albuterol with ipratropium is a common bronchodilator. It helps open up your lungs, and it's useful for patients with asthma. Studies have shown that when you use these inhalers, the nebulized mist can actually escape from your mouth and onto your cornea. When these medications get into your eyes, they can cause an angle closure glaucoma attack. Okay, so we went through a list of common medications, from antidepressants to decongestants and cold medications to sulfa medications and inhalers, which can increase your risk of developing angle closure glaucoma. So for high-risk patients, maybe ones with a history of angle closure glaucoma or patients with a history of narrow angles, you want to be extra careful when taking these classes of medications. And if you're noticing symptoms, Maybe you noticed your eye hurt one time, or your vision became blurry for 20 minutes and you felt some eye pressure. Those might be signs of angle closure bubbling up, so don't ignore them. Don't brush them off. Get your eyes and, more importantly, your angles checked out just in case. If you found the information in this video helpful, don't forget to subscribe to the channel for future updates. And if you live in the Los Angeles, Orange County, or Inland Empire area and want to get your eyes checked, feel free to visit our website or give our phone number a call to make an appointment today. By the way, if you made it this far into the video, that probably means you're really interested in protecting your vision and health. Check out the best ways to prevent glaucoma by watching my video here. I'm Dr. Michael Chua with Planet Hills Eye Care. See you next time.